That sudden lump you found down there? When is it just a simple pimple, and when is it a sign of something much more serious? Most women panic and start Googling worst-case scenarios when they feel a bump. But here's what most people don't know about vaginal lumps. By the end of this video, you'll know exactly what's normal, what to look for, and when you actually need to see a doctor. Let me explain what's actually going on. The skin around your genital area is incredibly sensitive, packed with glands and hair follicles. Getting a lump or bump here is very common. In fact, many of them, like tiny skin tags or blocked pores, are completely harmless. One of the most common causes we see in the clinic is a Bartholin's cyst. You have two small Bartholin's glands just inside the vaginal opening. They produce fluid to keep everything naturally lubricated. Usually, they're so small you can't even feel them. But sometimes the openings of these glands gets blocked. The fluid builds up inside, creating a soft, relatively painless swelling. Think of it like a water balloon slowly filling up. This is incredibly common, especially for women in their 20s and 30s. The real problem starts if that blocked cyst gets infected by bacteria. It turns into what we call a Bartholin's abscess. The lump becomes red, swollen, and very painful, especially when you walk, sit, or use sanitary products. You might even develop a fever. If it's just a small, painless cyst, soaking in a warm sitz bath at home might help it clear up. But if it's growing or painful, please come to the clinic. We may prescribe antibiotics or do a minor procedure to safely drain it. Never try to pop it yourself. Now, what if the bump looks more like a regular pimple? This is usually vaginal folliculitis, an infected hair follicle. It almost always happens because of improper shaving or waxing. When hair gets trapped under the skin, bacteria can turn it into a painful, pus-filled bump. To prevent this, make sure you frequently change your razor blades and always shave in the same direction the hair grows. Even better, try just trimming with scissors to avoid skin irritation. If the infection gets bad, your doctor can prescribe a simple antibiotic cream. We also need to talk about sexually transmitted infections, as they can cause lumps too. Genital herpes, for instance, shows up as clusters of painful, fluid-filled blisters that eventually crust over. It's a viral infection, but don't worry, it can be very effectively managed with antiviral medications. There are also genital warts, which look like flesh-colored, cauliflower-like growths caused by the HPV virus. Another one to watch for is a painless sore called a chancre, which is actually an early sign of syphilis. Both of these require a proper medical diagnosis and specific treatments. Another interesting one is Molluscum Contagiosum. These look like multiple small, shiny, smooth bumps with a tiny dimple in the middle. The surprising thing? You don't just get it from intimacy. You can actually catch this virus just by sharing a damp towel or a shaver. I know many patients immediately worry about cancer. Please take a deep breath. Vaginal and vulvar cancers are rare and mostly affect older women. The warning signs to look out for are abnormal bleeding unrelated to your period or unusual, stubborn growths that simply will not heal. So, when should you seek help? Here's what I tell my patients. If a lump is painful, growing rapidly, bleeding, or if you have a fever and abnormal discharge, do not wait. It's always better to have an experienced doctor examine it early before complications arise. For everyday prevention, keep the area clean and dry. Avoid harsh scented soaps that disrupt your natural pH, and wear breathable cotton underwear. Your vaginal health is so important, and there is absolutely no shame in getting these concerns checked by a healthcare professional. Remember, this video is for educational purposes only. If you're worried about a lump, please consult your doctor or visit our team at Klinik Temasya for personalized advice. If you have questions, leave them in the comments, share this with a friend, and check out our other women's health videos.